Our next speaker is Erin Bonzon. She's the Associate Director of Women's and Infants Health Association of Maternal and Child Health Programs. And she comes to us as a leader in women's health and infant health, and plays a critical role in fund development for women's and infant programs. She's worked with many organizations and been part of many efforts and opportunities for women's and child's health. She does have 2 master's degrees. She has an MSW and an MS, that's a Master's of Social Work, and an MSPH, which is a Master's of Public Health, from the University of North Carolina at Chapel Hill, where she was part of the leadership training program and was a HRSA fellow. She also has a bachelor's degree in psychology. So with that, we welcome you to say a few words about your program.
Thank you, and I'm also part of the Rochester Fan Club. I grew up in the great Western New York region, so wonderful.
You went to Fredonia.
I went to Fredonia. Happy to have Wegmans here finally, too. Wegmans is, for those of you from upstate New York, Wegmans finally made its way down to Northern Virginia. So. I want to spend a few minutes talking to everyone a little bit about AMCHIP. We are the Association of Maternal and Child Health Programs. I'd like to also introduce you to what is Title V in the block grant, talk to you about some current transformation efforts. Then I'll dive into an overview of the Affordable Care Act, what's in it to promote breastfeeding, what state Title V MCH programs are doing to promote breastfeeding, and discuss some key opportunities for partnership. I'd like to also introduce my colleague, Carolyn McCoy, Senior Policy Manager at AMCHIP, soon to be successful breastfeeder as well. So at AMCHIP, we support state maternal and child health programs and provide national leadership on issues affecting all women and children. Our vision is we envision a society where healthy children and healthy families live in healthy communities. Our core membership is made of the highest level leaders from state government, those working in maternal and child health, directors of state programs for all women and children, as well as programs for children and youth with special health care needs. Families are also an integral part of the work that we do, and other maternal and child health stakeholders from other professional and provider organizations are also members. Here's your brief history lesson. The Title V MCH Services Block Grant has a rich history of advocacy on behalf of women and children. Major milestones occurred in 1935 with the authorization of Title V of the Social Security Act, which created grants to states for maternal and child health. And in 1981, this funding was transitioned to a block grant formula, giving states the flexibility to spend funds where needed most in their population. And now is a particular exciting time for Title V block grant, undergoing some transformation to become even more accountable and coordinated around key maternal and child health issues. So what is this block grant? The block grant focuses exclusively on the entire maternal and child health population, requires a unique partnership between federal, state, and local entities. And as part of the block grant, states are required to conduct a needs assessment every 5 years, identifying and setting state priorities for their maternal and child health populations. This conceptual framework is a 4-tiered pyramid that describes the services and the various levels of funding for each service. The block grant is the only federal program that consistently provides services at all levels of the pyramid. Here's some of the scope of Title V services. State maternal and child health programs can promote breastfeeding by developing educational materials for new mothers, providing information about breastfeeding resources to all residents of their states through websites, publications, and toll-free telephone information lines. And many of these activities that I'm about to describe are led, coordinated, or conducted in partnership with other programs, such as state divisions of chronic disease prevention and WIC. And additionally, what we're seeing is a lot of MCH programs are now incorporating their breastfeeding, trying to improve their breastfeeding rates through a lens of chronic disease prevention and obesity reduction. As I mentioned, the Black Grant is going under some transformation right now, and the overall purpose is to improve accountability, reduce burden, and maintain flexibility. There's about 15 national performance measures proposed, and those that of particular interest to this group include well woman care, low-risk cesarean deliveries, and breastfeeding. So we all know the benefits of breastfeeding. We all know why we're here and why we do the work we do. We're also very aware of the barriers. Enter the Affordable Care Act. This represents a huge opportunity for improvement and for state Title V programs to make significant impact on breastfeeding rates. The Affordable Care Act makes it easier for women to access and pay for health care. It protects women, offers women more choices. The law improves health care benefits, particularly preventive service coverage with no copayment or coinsurance through plans sold through the health insurance marketplace and many other health plans. Under the ACA, new health insurance plans must cover and eliminate cost sharing for preventive services recommended by the U.S. Preventive Task Force, the Advisory Committee on Immunization Practices, and the Bright Futures Guidelines recommended by the AAP. Included in the ACA are services for adults, women, including pregnant women, and children. State MCH programs are uniquely positioned to understand the systems level view of the impact of ACA on their populations, and the state's role in implementation of the ACA have varied. This is a list of the preventive services for women, and this underscores the importance of women's health through the life course. There's three main opportunities under the ACA to promote breastfeeding and working with Title V. One is the Maternal and Infant and Early Childhood Home Visiting Program, also known as MICV. That's a federally funded program under the ACA, and that offers a real touch point for interaction with pregnant women and their families. The other is lactation support and health insurance plans. As Cindy mentioned, this provides support, supplies, and counseling. And the other is the amendment of the Fair Labor Standards Act. And this requires employers provide reasonable breaks for an employee to express breast milk for her nursing child for 1 year after the birth of the child. Employees are required to provide a place other than a bathroom that's shielded from view and free from intrusion from coworkers and the public for nursing mothers to express breast milk during the workday. It's also important to note that employers with fewer than 50 employees are not subject to FLSA break time requirement if compliance with the provision would impose an undue hardship. And these requirements do not preempt state laws, which often provide greater protection to employees. So at AmChip, we do a lot of surveying our members, producing resources and information, and we created this issue brief. And this issue brief is a part of a national project entitled Optimizing Health Reform to Improve Birth Outcomes, made possible with generous funding from the W.K. Kellogg Foundation. We did bring copies of the issue brief for everyone to have, and I think they'll be available downstairs during the reception. This brief is really exploring how states and communities have capitalized on the opportunities of the ACA to advance breastfeeding. It highlights partnerships, financing strategies, and best practices from state Title V programs. Here's a little bit about our process. And as I mentioned before, most, if not all, Title V programs are playing a key leadership role in breastfeeding promotion in their state. And so for the purposes of this issue brief, we really wanted to understand how Title V programs were taking a leadership and expert role in the implementation of breastfeeding support provisions of the ACA. Though there are many examples out there, we selected a handful of states to provide some in-depth information. This map displays the states featured in the issue brief. And AmChip staff recently talked with each of them to get updates on their work since the release of this brief. And now for some specific examples. I know we have quite a few folks here from California. Senate Bill 502 was introduced through the California WIC Association, and the California WIC Association will continue to monitor and evaluate the impact of the law. California is also implementing a breastfeeding-friendly healthcare provider certification program in community health clinics. These are safety net health clinics, and providing program funding to 15 community clinics. The clinics develop and pilot test model policies, improve staff skills in lactation support, and billing Medicaid for pumps and other lactation support services, and disseminate materials developed and pilot tested. As I mentioned earlier, California is doing a lot with home visiting. They've developed a benchmark measure to measure duration of breastfeeding among their clients, and they're also training home visitors in lactation support. Nebraska has a strong partnership with the Nebraska Department of Labor. This is the Department of Public Health and the Department of Labor. They've developed a quick assessment for businesses, and that this assessment tool helps businesses identify the essentials needed by a nursing mother in the workplace, talks to them about how to provide a reasonable break time, guides them through writing a straightforward policy and how to share that policy with all employees, and also helps employees plan a woman's return to the workplace before she goes out on maternity leave. New York is working to support and improve breastfeeding in hospitals, primary care settings, and work sites. This is all part of their overall prevention agenda, which is New York State's Health Improvement Plan. Of note is working with child care centers to have a breastfeeding-friendly designation. And as of April 2014, all maternity care hospitals have breastfeeding policies. And it's also to note that the New York State Department of Health has been reviewing and looking at a lot of these policies across hospitals since 2009. North Carolina's Division of Public Health has been instrumental in working again with a designation for their child care centers. They have adapted the HRSA business case for breastfeeding, and they're also using their chronic disease prevention work, their Eat Smart North Carolina, to work with businesses and disseminating information on supporting breastfeeding in the workplace. Their Medicaid agency has also designed a proposed benchmark definition of lactation support and counseling for lactation consultant coverage. And when we talked with the folks at Oregon, they had said that the change in the federal law was modeled from their Oregon wage and hour law. So they've done a lot of work at looking at their state laws, comparing them to how they hold up with the federal law. They are actively involved with providing technical assistance for employers and enforcing a $1,000 penalty per violation of the law. They've got some great partnership with their chronic disease folks. They're using their CDC chronic disease funds to really create some strong partnerships and connections. So Carolyn, who I introduced you to earlier, she recently talked with these states about their ongoing work and some of their next steps. This is just a sample. They've got a lot of work going on. I know that Carolyn would be happy to speak with anyone to help clarify anything that's written or talked about in this brief, as well as put you in touch with any of the states that we highlighted. All the states that were featured and the states that we've talked to are eager to share information and eager to help spread best practices. So with that, contact information, and like I said, we have plenty of copies for everyone, so please take and share. Thank you.